Okay. Hello, everybody. My name is Deanna Finch. I'm the Executive Director for United for Children. Thank you so much for being here, joining us today to learn a little bit more about United for Children services. And this is our fourth Lunch and Learn this year. This is our last one. And so we are celebrating that we have had a wonderful 2021 and we look forward to a wonderful 2022. And we have a lot of things and a lot of exciting things to share with you. Before we get started, I wanted to give you an update on where United for Children is today. In 2019, we created our new strategic plan after 50 years of existing. And our new vision is to focus on inequities, to build sustainability and trust, and create a comprehensive service model that fills gaps of our broken system. In 2020, of course, we had the COVID-19 pandemic. United for Children created hubs in partnership with leading childcare providers in the target population at most risk. Hundreds of thousands of cleaning supplies, PPE, and funds were provided last year, and we continued our key services virtually, increasing relationships and support. And of course, in coordination and collaboration with many, many other service providers. In 2021, United for Children was named the regional hub leader by Missouri DESE, and that is a coordinated support system that will guarantee families that have the knowledge and resources to make informed decisions that impact the safety, health, and education of their children. We are continuing that work still now in the readiness phase. And if you have not heard about this yet, please let us know. We will get you a form to sign up for additional sessions, informational sessions, or if you want to be a member of the leadership team, there is an application for that. In 2021, we have continued our strategic plan, which demands us to redesign our services in a comprehensive way. And we are going to share more information with you in the months coming. And in the future, because of that new design, because of that full vision of serving our clients, our child care providers, our families and children in a better way, we will be raising funds that will be needed to pilot that new service design in the St. Louis region with the expectation to expand that year over year. This new internal framework for our services will allow us to more efficiently provide comprehensive services to all providers in our region, no matter their zip code. Our new design for service delivery stems from community need. We have four values: community, equity, empathy, and trust. And to align program strategy and increase impact, the team worked over the course of the last 2 years, including handling the COVID-19 response, to design an operational framework. And this framework focuses on the three guiding principles that relationships must be at the center of everything that we do. Service delivery must be client-driven, and community-centric capacity building is crucial. We also recognize the need for different service opportunities for childcare programs and individual educators based on their goals and where they want to go. To align the programs, we identified commonalities between our program areas as displayed in this diagram: coaching, education, financial, and financial investment. And many people know us as our 6, 7, sometimes 8 throughout the years, different programs. And what we are trying to do is essentially help people understand that we provide these 4 core services, regardless of where that funding or where that program was created. Our team has been using this insight to build that cohesive design, allowing for those separate programs to be built into one United for Children program. And this streamlined process will allow for deeper impact within the community, which will be seen through comprehensive data and outcome attainment. Then over the next 3 years, as we pointed to just for a second, our goal is to raise an additional $1 million to pilot our new design for service delivery in the St. Louis area. And currently, due to our funding structure, each of our programs are limited to certain geographical footprints. And we know that causes confusion and and gaps in service to childcare providers who need it. And we want to provide those core areas of expertise and support to all providers, regardless of that zip code. Our goal is to first pilot the approach in the St. Louis area with a long-term plans to later expand across the river and across the state. If you have any questions or are wanting to know more about what we've gone over, please write them down. We'll have a Q&A time after our panel. And then I'm happy to jump in to answer any questions you have about United for Children during that time. So that is it with our update. And we are going to pass it off on to Gina Dadalo and our wonderful panel members. But we are just so happy that we're not alone in our vision for St. Louis children and our communities. So thank you all for being here. Thank you for making children a priority. And we cannot say enough that we have to work coordinating and collaborating with many partners across the state to get the work done. We all can't do everything, and we have to trust and work with each other to get the work done. So we have a great agenda this afternoon. We used the feedback from the Lunch and Learns in 2020 and then continued through this year to create a series of Lunch and Learns that dives more deeply into why United for Children does the work that we do and why our most vulnerable children in our communities need more investments into early childhood learning. Excuse me, I have to move my notes over so I'm not just constantly looking away from the screen, but bear with me. Technology. Today, we'll hear from 3 of United for Children's community partners to learn how our work interlocks and intersects with other organizations' work. We really could not do this work alone without coordination and collaboration from other organizations in the community. So I'm so excited to hear, for you all to learn and for me to hear about all these incredible organizations. Our moderator is Gina Dadalo. Gina is an educator specialist, educare specialist with United for Children's, and she has worked in early childhood for more than 25 years. United for Children works with Arches to manage and provide educare services. While educare services are new to United for Children this year, we have had experience in previous years, but Gina is not new to United for Children. She has worked with us in multiple capacities in the past, and life just keeps bringing her back. She can't get rid of us. And we're happy about that. So our panelists today are Amy Flesher, Director of Early Childhood and Parenting Initiatives with Arches, Carissa Figgins, Assistant Chief of Community Impact with Child Care Aware of Missouri, and I'm sorry, Noreen, can you say your last name? I don't want to say it incorrectly. Noreen
Conti.
Thank you. I was going to say that, then sorry, should have double checked.
No problem.
She is the Vision Screening Coordinator with Delta Gamma Center for Children with Visual Impairments. Take it away, Gina.
You know, just when you think you got everything going, you hit the button and it doesn't do anything. Yeah. Well, welcome to Thursday. And it's a chilly morning. And if you like the chill, you're excited. And if you hate the chill, you're freezing and you need more coffee or hot tea. So if you need to take care of yourself, that's great. What we're going to do is just kind of start off with a brief hello or introduction from Amy, Carissa, and Noreen. I've come in contact with quite a few of these ladies over the years, and it's always good to hear from your experience information about what you do. So if you guys could go ahead and just give us a little bit of information about yourself, an introduction, and then we'll go ahead and move on to a few questions. And if Amy, you could start the conversation, then Carissa, then Noreen, that would be great.
And I will go ahead and get started, Gina. You just need me to give an introduction of myself. You're muted.
That little thing doesn't like to work this morning. So if you could just give a little bit about yourself, but also your organization's work.
Sure.
What does your team accomplish for our region? family. We'll get into that. Let's just go ahead and start off with tell a little bit about what your organization's work is.
Right. My name is Amy Flesher, and I'm the Director of Early Childhood and Parenting Initiatives with Arches. So I work in the Early Childhood Department. And we are a community partnership in the state of Missouri, and there are several across the state. So our job is, and our mission is to partner with agencies in the area to improve the lives of residents in St. Louis City, St. Louis County are our main service areas. And we receive grants from different organizations, DSS, DESE, and then we contract with different organizations in the area that are already doing the work. And we partner with them to provide those services. And our goal is to really try to end intergenerational poverty in the area through these services.
Thank you, Amy. I appreciate it. And Amy's actually one of my former coworkers from Arches. So hi, Amy.
Hi.
Thank you. Okay. Thank you very much. Carissa, can you give a brief introduction of your position and your agency?
Absolutely. Hi, everyone. I'm Carissa Figgins. I'm the Assistant Chief of Community Impact with Child Care Aware of Missouri. I have been in and out of the early childhood kind of ecosystem, especially in Missouri, for the last probably 30 years. And I know that's hard to, like, since I look like I'm 29, it's hard to see that I've been in the job for 30 years. But I've been a classroom teacher, a preschool trainer, parent educator, across the board. And then I landed with Child Care Aware of Missouri in January of this year. So it's been a fun year with all the things changing around the state and around the region to jump into this work. So a little bit about Child Care Aware of Missouri. Our mission is to raise the quality of childcare and educational experiences across the state of Missouri by improving all of those childcare services through training, education, quality standards, coaching, business supports, and then now with my position, policy work and advocacy. And the way that we do that is really multifold, multidimensional. So we make sure that childcare works for families. So we make sure that families have childcare where they're needed and when it's needed. We work with those childcare businesses to help them access resources like professional development opportunities, and then any additional knowledge that they would need to improve their interactions or the development of the children in their care. And then we are advocates for a professional development system and offer the training for Missouri's childcare workforce. And then we manage things like the Teach Missouri Scholarship Program, CDA, and the CDA Scholarship Program.
Wonderful. Thank you very much. And Miss Noreen, can you introduce yourself?
Hello, I'm Noreen Conti, and I am the coordinator of our vision screening program at the Delta Gamma Center. A little bit, like, I've been in early intervention for probably about 30 years. I started off as a service coordinator for First Steps. Well, first in New York, I was in the early intervention program, then we moved here. And in 7 years ago, Delta Gamma wanted to start a vision screening program that really focused in on those families living in low-income areas. And they hired me to start that program. And that's what we've been doing. But I wanted to give you a little bit background of what Delta Gamma does. In almost 70 years ago, some Delta Gamma sorority alumni from WashU started the Delta Gamma Center to serve the needs of the families who had children that were blind and visually impaired. Now, this was way before early intervention, before special ed. They really wanted to teach these parents how to help their children before they started school. Back then it was like 5 or 6. And so for the past 70 years, we have been doing early intervention for parents. And now that the kids really start going into the school district at age 3, we have the early intervention through First Steps, but then we also have what they call a GRADS program. Knowing that there's probably maybe 1 or 2 kids in a whole school district that may be blind, we bring these kids back once a month and they get to be with other kids, their peers, from age 3 all the way to 21. And they do, they develop friendships, independence, and participate in community activities. So that was the main focus of Delta Gamma. And then, like I said, 7 years ago, they brought me in, and we wanted to provide a free community service and try to catch these kids that may be developing what we call amblyopia or lazy eye, try to catch them early, because if left alone, that eye can become blind. And so this is sort of a prevention, for the community to find these kids early. And so we've been out there doing, going and screening low-income daycares in a 50-mile radius from our office, which is in Richmond Heights. So I'm going into Illinois and Missouri. In 2019, we screened close to 4,000 children, and we found 673 kids that needed to see an eye doctor that probably would not have been picked up for maybe until they got into school. Last year was kind of low because of COVID, but we still got to close to 1,500 kids that we did last year. And this year, things have been going up a little bit. We're at 2,300 right now for this year. But we have a special kind of camera that, a child can be as young as 6 months. And all they have to do is look at the camera, and within seconds, it takes many pictures with infrared light and then compares it to their age and will tell us whether they're, if there's any vision problems. And we can come up with diagnosis of, astigmatism, nearsightedness, farsightedness, or what I call the lazy eye. So that's basically, in a nutshell, what Delta Gamma is and what I'm doing.
Awesome. Thank you very much. So the first question that I'd like to ask is, how does your work intersect with United for Children's work? Can you share specific examples to illustrate how our organizations work together or collaborate? And Amy, can you go ahead and answer that first, and we'll just kind of go around again?
Sure. In the early childhood realm, we recently collaborated with United for Children with our Educare grant, as well as our Infant Toddler Specialist Network grant, which used to be housed in Arches, and we've contracted with United for Children. So the United for Children staff are delivering those wonderful and much needed services to the surrounding St. Louis area. And in our Infant Toddler Specialist Network, they go out into St. Charles County, Lincoln, Warren, to provide those services, to increase quality care, to help providers serve children, serve families, and give them those training opportunities they need to improve that quality of care. Are two examples of how we're partnering with United for Children right now.
Great, thank you, Amy. One of the things that I like as an Educare specialist is we also provide additional trainings to anybody on the United for Children website if you're
Right.
looking for additional trainings, because it's challenging for providers to find infant toddler training specifically. And so
Absolutely.
there's a lot more opportunities for people to access that. And then trainings in the evening are funded through this project, and one evening a month and one Saturday a month.
Right.
So I appreciate that. I know a little bit more about your collaboration, so I appreciate it.
And I think looking at those trends that providers are telling us, I need more information about this.
Yeah.
And United for Children had an awesome training department before we kind of added in ITSN and Educare, and it's just so
Great collaboration.
And I think one of those things with COVID is there are pieces that we had to build because of the pandemic that are not so bad, because I think in a lot of ways, these virtual trainings were able to reach more people than we were in a face-to-face
That's true.
realm.
Yeah.
That, so that is always great.
Thank you very much. I appreciate it. Carissa, can you answer the question? If you want me to restate it, I can, but do you need that?
No, I'm
One
good.
more time. Okay, great. Just wondering.
No, we absolutely love our partnership with United for Children. We intersect at many different ways. One of the ways that we partner with United for Children is they serve as one of our capacity building partners for the entire St. Louis metro region. And so they actually act as an extension of Child Care Aware of Missouri in St. Louis. And that is essentially to increase the capacity of childcare. We know that across the state, there's shortage, there's closings, there's losing capacity, but we're not losing kiddos. So we all need places for children, and that's just a dire need for an economic development and a workforce development standpoint. So U4C is very critical for that for us here in the St. Louis region. One of the I guess I use the word project, but one of our goals between that collaboration is to recruit those entrepreneurs in the area who may not identify themselves as entrepreneurs, as doing a startup for childcare, or if they already are a childcare provider, of expanding that business in the region. And then U4C also holds the contract for inclusion referrals. And so while we do basic referrals at Child Care Aware of Missouri, any specific concern or any children with special needs, we try to do a warm handoff, at least to U4C, to provide that kind of holistic approach for families that would be looking for very specific care, no matter where they are in the state. So those are just two. We partner in many different ways, but those are the two that came to mind that were just really critical and have ongoing impact.
Yeah, and I appreciate you because the resources of all the documents, because I do technical assistance with programs, but I don't know everything or how to get to it. And the resources of having the documents available for people to make even a handbook or something like that, there's a lot of opportunities at CAMO for that. And then also for the CDA program, because in order to raise quality, we know we have to raise education, but how do we get there in a field that doesn't pay very well? So I appreciate that we still have that available in our region for providers, and then also for the whole state of Missouri.
And very specific, especially like the CRISA funds, which anybody knows me, I like to say that because of my name. It sounds like I'm a billionaire, but I'm not. But being able to communicate that to providers in the area, that there is a significant amount of funds available, and helping them navigate. I know U4C has been really critical in helping to like almost translate those documents to providers of how they can have access to those funds. But then also you were referring to a lot of the documents we have in the Show Me Child Care resources.
Yeah.
But then also, I hesitate to say this because I'm not exactly sure if it's up on the website, but if it's not, it'll be there soon. We've updated our startup guides. So for anyone that's considering a family child care program or a center, we have startup guides that include checklists. And these are the things that need to be thought and considered when they are becoming small business owners of a child care center.
I appreciate that. Thank you very much. And Ms. Noreen, can you go ahead and answer the question? Do you need me to restate it, or are you good?
Nope, I got it.
Great, thank you.
Certainly with United for Children, having the reputation and helping so many of these daycares, it helps us get into these daycares. We also are collaborating right now with United for Children on a grant called Project Launch, going into small in-home daycares in the city. And then I've been working with the PACT program in the Normandy area and trying to reach every one of the daycares in that area. So they have been, wonderful to be able to talk about who we are and what we do, and recommend for the directors to give us a call and get them signed up, because I have a tough time just emailing them, and I hate to call daycares in the middle of the day, and many of them just don't read their emails. And so United for Children are the ones that are getting out there and really letting them know the service that we have.
Right. And personally, because I'm an educator, I know you've been talking to Chantel. And so she asked us if we would collaborate. And one of the things that I love is your flyer, because it took it step by step for a family to understand what the process is. Because a lot of times families either do jump to sign up their kids or
Yeah.
won't. And
Right.
so giving clear understanding of what the Delta Gamma is going to do for them, I really appreciate that.
Oh,
And
good.
one of the things that I am going to do is we have tea time, and it's where we bring together providers for resources. And so I reached out to you because the thing is there's a lot of different agencies in St. Louis, but like you said, getting to the providers is tough sometimes.
Mhm.
And so these collaborations are so important. And
Definitely.
yeah, I used to work with somebody at the state, and she used to have a big sign on her door that said "Collaborate or Die."
Okay.
And I hate doing, but I mean, that's the truth, because there's only so much funding and so many opportunities. But if we all work together, it begins such a strength. So I appreciate that. So
Yes. Yes. No, that's great. Mm.
thank you. So the next question is, why is it important for our communities, organizations to collaborate? So Amy, you want to take that one?
Well, I think when we think of all the work that has to be done, we can't do it on our own.
Yeah.
And we have these partners and these agencies that we can collaborate that are doing things well. And when you're able to collaborate with those different organizations, you can give your client, you can give your provider or your family all of the things that they need to be successful.
Mhm.
And I think we're stronger when we do that,
Mhm. Mhm.
versus trying to do everything and being stretched in 100 different directions.
Right.
So that is, for Arches, it's really in our slogan about the power of partnering,
Mhm.
to meet the needs of families,
Mhm.
to improve their lives, whether it's improving the quality of care that an infant gets at a center versus a vision screening, professional development for those providers, for educare. Um, in my time at Arches, I was an ITSN coordinator and I was an educare specialist. So educare is about giving business knowledge to our providers so that they could run a successful business and they can continue to provide that quality care to families. So partnering enables us to do all of those things and not be stretched, because when we're doing many things, we're not always doing everything well.
Mhm. Mhm.
Well,
So we're
thank you.
depending on who we partner with. You guys are doing that well. You guys are doing that well. And then our clients are getting the best service possible.
Yeah. Thank you, Amy. Miss Carissa, you want to answer the question?
Absolutely. Like, and just to echo on of Amy, I always mess up these kinds of phrases, but I think about like when we try to do everything and that's not our strength, we become like a jack of, I think it's become a jack of all trades, a master
Right.
of none.
Right.
And we don't, we like lose our impact. Collaboration is so, it's so important to me. And I think about like, most of our organizations, all of our agencies have some sort of a flat hierarchy. And like most of the decisions are made at the top and then they kind of trickle down. And so it's that vertical organization. But when you collaborate with other groups, when you collaborate with other agencies and organization, then that leadership becomes much more horizontal, because then everybody feels accountable for something. They are all leading something from their strength. And that's where that collaboration gets really creative. And you can move a little bit more, have a little bit more fluidity in what you're doing. We have our different areas of focus, our different areas of influence. And that's where like each of us are connected to our communities in different ways. And we start to bring those people together. I know you foresee, as well as all of us, should be focusing on that trust And when we go outside of our own walls and when we start to collaborate and kind of link arms with everyone, that sends that united message to anybody that's interacting with us, that if you like if Arches is involved with something with United for Children, then you can trust that that's been well thought out of, and that's that's what's best for children and family. Same thing with Child Care Aware Missouri or Delta Gamma or anyone, that if we're all linked arms together and there's not that competing messages or competing outcomes, that's where we start to make a difference in our community with that level of trust. And I think also just keeping the conversation very personal and very, very conversational, keeping our conversations conversational, because then you can be more honest and you can have the flub ups, but you can have those very real and authentic conversations of what's working in our communities, what's not working in our communities. So that collaboration allows for so many things to happen that we can't just do on our own, and we shouldn't do on our own. So I'm a little passionate about collaboration and breaking down those walls, if you can't tell.
We're gonna have to make you the collaborator die sign, is what I'm
There you
hearing.
go.
Thank you, Ms. Carissa. Noreen, can you go ahead and follow up?
I guess, what Carissa was just saying, the trust, that is something that, I know when United for Children are into these different daycares, the daycare directors already trust them. And so if they're telling them about our services, they're a little bit more, okay, well, I'll try it. And we sort of do the same thing, that if we're into, especially now that we're going into the in-home daycares, the smaller ones, I often tell them, are you doing anything with United for Children? And, some of them don't know about it or whatever, that, I'm able to go back and forth and give them your resources also. So, this is the only way I'm able to find these other daycares that we're not in, is through collaboration, because I've done it all the other ways and it's not working. So the collaboration is the main way.
I totally understand, Noreen. Deanna, you unmuted yourself. Did you want to say something?
I did. This is something I'm also passionate about. And I would like to give like a tangible example of what that would look like. For instance, Noreen just said that there's no way that they could get to as many children as they do if it wasn't for those referrals and those relationships that United for Children has with childcare centers. And then the impact of that. What is that impact? If children can get screened for visual impairments before kindergarten, like many times, if they get screened, it's the first time once they get into the school system.
Right,
and
right.
Sometimes it's after many challenges, right? Behavioral challenges, bad test taking, right? Low scores and those kind of things. And really and so they get disciplined, or they have negative experiences with education. And when it comes down to it, it was probably just because they couldn't see the front of the room, right? And so what if we can get them screened and they can navigate their challenges before they get into kindergarten, and they start school in a positive note and they don't have all those negative experiences. So that I love being able to connect how collaboration impacts that child. And but that's just a huge, just one example that I love to share. And that's why it's also very important. And to Carissa's point is that, yes, in the last few years, we have had real, vulnerable, open conversations, because that's what it takes to be able to get things done. And that trust is so important. So thanks for letting me step in for a second.
Hey,
well, another thing that you brought up is a lot of times I would lean on the United for Children staff that go into these daycares to get the paperwork that I need back before we can go in there. Or our next challenge is, once we find these kids that need to see an eye doctor, is getting the parents to go see an eye doctor and get the glasses they need, or if the glasses are broken, or even having the parents bring the glasses to school. They're afraid they're going to get broken, so they don't send them to school. So, you know, it's that kind of interaction for the people that are in the daycares. They help us do that back stuff that we can't, because we're only there for the day that we do the screening.
Awesome. Well, thank you. Thank you for attending, but also thank you for your passion and your insight. I've seen a lot of things coming up in the chat, and I want to give an opportunity for question and answer. If anybody has a question, or if you want to mute and just say hi, because I know a lot of people collaborate with people and we don't get to see each other face to face right now. So if you just like to say, hi, I'm Gina from Educare, thank you, or do some connection like that also. But if you do have a question, we'd love to hear from you. Miss Lakizia said hi. I want to do a shout out. Miss Deborah Tolliver, I haven't seen her in forever, and she's one of my favorite people. And she messaged me directly and, hi, Miss Deborah.
I really miss you, Miss Gina.
Love you too.
I want to say thank you all, because you all came out to my center, this Early Explorers. And
Yes.
hi, how you
Hi,
doing?
Vanessa. Good.
And the parents were so appreciative. And we still got that one parent that will not take her baby to the doctor.
I know.
So but I really do appreciate all that you are doing. Thank you so much.
You're welcome. We love coming out to Early Explorers.
Anytime.
Another person just put in the chat. Thank you, Noreen, for putting your information too,
Yes.
because I think one of the questions is how do people connect with you?
Yeah.
And if you would either put your website or information for connection in the chat, that would be great.
If the flyer, if they click on that, it will tell them how to contact me. The best way is to email me, because we're still remote. So emailing me is the best way, and we can come up with the date and get you on our calendar.
Awesome. Lisa Greening's here also, the director of Turn the Page St. Louis, a collective organization around improving reading proficiency in the St. Louis community. Love seeing Lisa's post on Facebook. She's everywhere. So Lisa, if you want to mute and say howdy, you can too.
Everyone, this is very exciting. We know literacy starts at birth, and we know that we need to get to families then, and we need quality childcare programs, quality and more. And there's so much to it. But if we had programs like Early Explorers for every child in the St. Louis community, this is what I think of all the time. All that other stuff would go away. All of the money that we're pouring into getting teachers in 3rd grade to teach children how to read that were passed up because they didn't have a large speaking vocabulary when they entered school. All of that stuff would go away. So I'm here to advocate any way I can, and have been for a while, I guess, for more and better services for our kids.
Lisa, can you also put your information in there? So if somebody wants to contact you for any resources, because this is a great way for all of us to resource.
I also want to say that Lisa Greening and Turn the Page is an example of collaboration that's not formal, right? We don't have a contract with Lisa Greening, but because reading, early childhood education, all of that connects together. You know, we talk often, and the different opportunities and the different ways we can know what's going on and be responsive and proactive about the things going on is another way of collaboration that this industry is needing more of. And I'm just very appreciative of those type of collaborations as well.
Thank you. Does anybody have any specific question for one of our panel members that you'd like to ask?
Hey, Gina. Someone asked in the chat if Parents as Teachers is a part of United for Children. I don't know if you want to tackle just explaining the kind of differences in the organizations there.
Well, and actually, PAT National Center was started here in St. Louis and still resides in here. And I know a lot of you guys collaborate with them. The cool thing about Missouri is every school district has parents as teachers funding. So anybody can access it. When I worked with teen mothers years ago at Grace Hill, one of the things we did was we talked to the local school that had parents as teachers, and they would come in during our meetings and access the families, my teen mothers that I was working with. So it's another way to collaborate. You can actually invite them to your program, and they can do screenings with the kids, work with the families, of course, with the family's permission. But they can also go to the home, but not everybody wants people at their home. They're willing to flex on that with us as providers. Kenya, I see your head nodding. Have you used parents as teachers before? Yeah.
Yes, I have. They're awesome.
Okay. What did you use them for? What are they so awesome about?
Well, I had one, Miss Dana. She did an assessment for a kid for me because I was trying to do the ASQ the forms. And I was explaining to her, I said, I can't do this one particular child. I said, excuse my French. I said, but this child knows nothing. And he was 2. He wasn't walking. He wouldn't sit up. I mean, he would fold his legs back, and she was doing the assessment. She said she basically had to give him a number just to put him on the screen. But, later on we found out he was autistic. So I was telling the mom, and she said, well, people always say, well, boys are slower. She took me through the whole thing, and I was like, oh, I love her for it.
I can hear it in your voice.
She gave me the referral to give to mom. And, she took the assessment that Ms. Dana had done for parents as teachers, gave, copy to the parent, and she went and had the child tested.
Yep. I appreciate that because it's not, we don't have to know everything as teachers, as directors, as people that work to support teachers and directors and families. The thing is how you connect to somebody, and it's another resource. Parents as teachers is free in the school district, and United for Children, what we do is we collaborate with them, just like a lot of the people on the panel, and it's another opportunity. The other thing is, don't forget, United for Children has inclusion services too. So we as teachers in any kind of childcare can get support that we need for how to work with every child, because a lot of people say, well, they need to go to that childcare, there is no special childcare. We are all the special childcare providers. So we need to know how to meet a child's needs, and depending on the kid, it may be different, but you gave the child and the family what they needed, and it doesn't always have to be from us. That's what true collaboration means, is that we know who to go to get the needs met. So thank you. Thank you for talking about it, because, it's one of those, I can speak to it, but you had a lovely experience. So thank you.
Absolutely. And Gina, I want to answer that question a little bit more too, because parents as teachers and United for Children are working closely. We're partnering together for the St. Louis Regional Hub readiness activities for the DESE's Regional Hub. So that's also, if you see us in the same headline or anything like that together, or when we're talking about it, we are partnering to really talk about what does our region need? What does our families need from all the services that are here, and how can we get more services to families? So we are working very closely with them as well, but we are not the same entities. We refer them just like we refer Delta, Gamma, or any other service provider.
Okay. I have another question. Nurses for Newborns, you all work with them?
Yes.
You do? So
collaborate with them.
Okay, because I have a mom, she just had a baby 2 weeks ago.
Yes.
And I don't know if I can give her a referral to them.
Well, you can always give referrals to any agency, and then they can see what they can do to support you. It's always good to have resources, Kenya, no matter what they are. We actually been talking about this internally, but always know who it is that they can talk to, and then support and follow up with the families, because it's nothing worse than getting a resource that is like a dead end. So yes, the other thing is again, parents as teachers, and there's other supports. I can also put my information if you ever want to collaborate with anybody. We'd love to hear, directly from you, and
Yes,
I'd like to
please.
follow up with you. Okay.
Yes, please.
So if you want to put your information and send it directly to me, I can reach back out to you. I appreciate
Okay.
that. Okay.
Yeah, just to repeat that, again, is that our inclusion services definitely go into a childcare setting and can work with you as a teacher, as a director, also directly with that family and that child. But part of that work is figuring out what other resources they need, right? So if you need
Yes.
a general observation and assessment, and then we can figure out together what the next steps are, our inclusion specialist will be able to figure out what those resources are. So you're not just calling and calling and calling. We can connect that for you.
Okay.
You got a prop in the chat. It's like, Kenya, thank you for being a phenomenal educator. And if we didn't say that, we want to tell you thank you for taking the time out. Everybody here is important and everybody counts. No matter what your name is, no matter what your title is, we're all here to support children, families, and each other. And thank you for taking that time out. I'm going to go ahead and hand this to Megan.
Gina, actually, there was one more question we haven't gotten to
Oh.
quite yet for our panelists. If you want to just, we can go ahead and address that last one, and then you can pass it back over to me.
Okay, great.
It's
So what is your organization's history of collaboration with United for Children?
in what ways can collaboration between organizations impact equity in our region?
Okay. If you could repeat that one more time, Ms.
Yeah,
Megan.
yeah, sure. In what ways can collaboration between organizations impact equity in our region?
So Amy, would you like to answer that? And then we'll go ahead and go around the group.
Sure. Here at Arches, our early childhood department is just one department. We have a K-12 department where they also collaborate with United for Children, working with after school programming, as well as our family and community that does a lot of reentry and a lot of workforce development. So in our mission, we talk about wanting to end intergenerational poverty, and we do that through our programs. And if we look at just the EduCare and the ITSN program, it's trying to provide equity so that all families, regardless where you are, can access quality childcare where children are safe, where children are learning, regardless of where you are. And we know anybody who works in the early childhood field right now, I don't have to tell you how the pandemic has really brought so many things to light that everyone on this call has known that have been issues of just getting staff, right? Just getting staff to make it through the day is a problem in the St. Louis area, but it's statewide. And I've been participating in a national conference. It's not just statewide, it's all over the country that we're having those issues. So at Arches, the EduCare and the ITSN program, we have a workforce development program that's trying to provide skills and trying to get St. Louisans the skills they need to work to provide that equity. So I really think the collaboration, like we said before, we can't do everything. And when we're able to tap into different organizations that do things well, it's going to serve our community better.
Great, thank you. Ms. Carissa, can you go ahead and answer the question?
Sure. I think the importance of collaboration and equity is that we start from a place of equity, that's what the first question that we do, rather than trying to figure out where we squeeze it in, where this might check off the equity box. That is not the right mindset when we're working with collaboration. And again, going back to that idea is that leadership is across the board. It is not just assigned to one person when you're in a collaboration. We can start with that question of what is the best outcome for everyone. and how do we use our skills, how do we use our resources and assets to benefit everyone, and not even use the word regardless of where we live. That's just our starting assumption, is that everything that we do benefits those people that we're trying to work with and help. And I think even though we're talking about collaboration and partnering, sometimes you do have to start from equity, even when you're standing by yourself, and realize that that's where some of those connections are going to start, is because that you're that ambassador, you're that champion of trying to impact and reach everyone that's involved. I think it's also, there's just starting to look through that lens of equity, even from a data standpoint. So, we know, unfortunately, with the data that we have available to us and that we share with the community, is that so many of the childcare programs that have closed across the state are those that we didn't need to close at all. They were already in impoverished area. They were already being operated by women that did not have access to every resource that they needed to. So that's one of those collaborations, how do we come together and slow this wave of closures, not only from impacting small business owners, which are mostly women of color, but all of those children in those areas that are not going to have those quality early childhood experiences that are going to set them up for success in school and that are going to set them up for success in life. So I think just from a collaboration is that we get to start from that beginning of how do we, when we're in collaboration, how are we impacting everyone? How does everyone get to have the best outcome?
Thank you. Miss Noreen, can you go ahead and answer the question?
Sure. I would say with the collaboration with other organizations, for example, when I'd mentioned we find these kids that need the eye to go see an eye doctor and get glasses, but sometimes that's a huge hurdle for families to do it. So I've been collaborating with Kids Vision for Life and iThrive, that they have buses that usually go to school districts. But last year, because the schools were all closed down, we were able to get 2 clinic days that I got all of the daycares that were in that area, and all the kids that were referred was able to go and get a free eye exam and glasses that day. And during the summer, they have clinics. So I get out to the parents, that they have these opportunities. But this was something back 7 years ago when we started this program. We could have gone out to all daycares and provided vision screening, but we found that we wanted to stay with the daycares that serve the low-income families, because I don't think they're getting these kind of eye exams at their pediatricians, and these kids are being forgotten, until they get into school. And we could have opened it up when it's difficult to get in and do all, but we've wanted to stay and only do low income. And it's, sometimes it's harder to get into there, but we really feel as if these kids need to be found and, taken care of early on, because it is affecting their development, and they do not need one more hurdle to get over before they enter kindergarten, with poor eyesight.
Yeah.
So.
Thank you very much. And as you guys were talking, I kept on thinking, my dream is to quit personally, and then also professionally, to quit surviving to start thriving. And that's my hope for our community that we serve, and for ourselves too. Because some people are still in survival and not into thriving. And so my gift to you is that I hope that I can help support you as you get to that. And so I appreciate all these collaborations. Everybody that's here at the table is part of that collaboration, so that we can quit just surviving and look at thriving opportunities. So with that being said, I appreciate everything that you guys have talked about. Megan, I'm going to hand it off to you to kind of wrap us up.
Yeah, thank you for that. And thank you, Gina, and just all of our panelists for just this discussion today. I know I personally have learned a lot from what you all had to share, and it's nice to hear it straight from you, being the people doing the work with your organization, rather than just, casually coming across what you all do on social media and your websites and things. So thank you for joining and being able to share all of that insight with us today. My name is Megan Mansouri. I'm our Marketing Communications Coordinator. Thank you to everyone who joined and asked questions. I love that we had a good conversation today, and hope that you all learned something today. And we are currently in the process of planning our Lunch and Learn series for next year, for 2022. So if you haven't already, I'll be sending out an email tomorrow to you all with a link to our survey to take to help us pick what those topics are for next year. So we really want to hear what all of you want to learn more about. So please give us your input and your insight on what topics you'd like more information on, so that we can make sure to work that in for our Lunch and Learn series in 2022. And then I also just wanted to